Welcome to the East Cheshire NHS Trust antenatal film. My name is Fiona and this is my colleague Ros, and we're senior women's health physiotherapists based at Macclesfield Hospital.
And I'm Alison, I'm the parent education midwife at Macclesfield Hospital. And this film is to complement the antenatal classes that I'll be providing for you later on in your pregnancy.
We hope you find the film useful and informative.
So congratulations on your pregnancy. In this section, I'm just going to give you a bit of early pregnancy advice. If you're watching this film after booking with your midwife, you're probably somewhere between 8 and 12 weeks pregnant. You may still be in the throes of nausea and vomiting, but don't worry, that's quite normal and that should wear off within the next few weeks. If you're struggling with what you eat, just try and eat little and often. A good varied diet, but don't eat any foods that trigger your nausea. Do what's best for you. The important thing is to drink plenty of fluids. We say about 2 to 3 litres a day, and that will keep you healthy and hydrated, and it will also help with avoiding other things that you can get with pregnancy, like headaches. Now, there are some things that we ask you to avoid while you're pregnant, some particular foods. The main thing is things need to be well cooked and pasteurised. So that rules out unpasteurised soft cheeses like brie and camembert. You should also avoid blue vein cheeses. Be careful of anything that's rich in vitamin A like liver and pate products. You need to avoid shark, swordfish, marlin and raw shellfish, and that's because of levels of mercury that's within those fish. The other thing that you may not have known is that you need to restrict your tuna intake. It's okay to eat a couple of small tins a week of tuna, about this size. You'd be fine with that, but try not to have any more than that, and that's also because of the mercury content. The other thing to remember is that your eggs need to be thoroughly cooked. No runny eggs, no runny yolks. And that also means that you need to be careful with mayonnaise. If you went to a posh restaurant or you made your own mayonnaise, then it would be made with raw egg, so you'd have to avoid that. But if you go to the supermarket, just check the labels. If it says it's pasteurised, it's absolutely fine and you're safe to eat it. So the main thing is everything in moderation. Try not to succumb to too many cravings, but don't worry if you do, because we all do it. Enjoy your pregnancy. As you move forward into the second trimester of pregnancy, all these minor disorders should disappear, and people will probably say that you're blooming. So congratulations, and enjoy the rest of the film.
Many women experience aches and pains during their pregnancy. This is a model of a pelvis, and one of the causes of the aches and pains can be due to a hormone called relaxin. This softens the ligaments throughout your body, including the ligaments around your pelvis. And you may experience pain either at the front here, on the pubic bone, or at the back on your sacroiliac joints. If you do experience these pains, mention this to your midwife, and if necessary, your midwife will refer you to physiotherapy for some treatment. Another cause of pain can be back pain. This often is due to the changes of your posture. As your bump grows forward, your centre of gravity moves forward and your pelvis tends to tilt slightly in this direction. This puts quite a lot of strain on the small joints in the lower back. A correction for this is to tilt your pelvis backwards into this position, which flattens your spine a bit, and I'm going to demonstrate that now on Fiona. So Fiona is now standing with an increased curve in her lower back and her tummy forward. The correction is to tilt your pelvis backwards, tuck your bottom under and tuck your tummy in. As she does that, she flattens her spine a little bit. So to find the correct position, tilt your pelvis as far forward as it'll go, as far back as it'll go, and come to rest somewhere in the middle. As you do this, you'll find that your weight, as you tilt your pelvis forward, falls forward onto the balls of your feet, and as you tilt your pelvis back, falls back onto the heels. You'll be better balanced with your weight further back onto your heels. Find yourself a position in the middle, and we call that a more neutral alignment. In that position, lift up with your sternum, and then that way you've got a nice symmetrical posture, and it helps take some of the strain off this part of your back, which can ache if you're very round-shouldered. Okay. When you're carrying shopping, it's important that you don't carry all your shopping in one hand, as demonstrated by Fiona, which again leads to a loss of symmetry. So if you place shopping equally in both hands, you can see now that Fiona is in much better alignment and takes some of the strain off her back. Postnatally, when you're carrying something heavy such as your car seat, it is important that your car seat is close to your body. So again, don't carry it in one hand because the baby becomes very heavy very quickly. Place the car seat in front of you with your arm underneath the handle, another hand on the car seat to steady it, and hold it close to your body. Think about your posture even when you're sitting on the sofa at home. Fiona is demonstrating how not to sit on the sofa at home, and I'm going to correct it. I'm going to ask her to uncross her knees and slide her bottom to the back of the seat. In this position, you might need a small pillow or a cushion behind the small of your back. We're now going to demonstrate a good position for lying or sleeping. I'm going to get Fiona to roll onto her side, keeping her knees together. We're going to use some pillows for support. The first pillow goes under the baby bump. The second pillow goes under a knee, which keeps her pelvis in a more symmetrical position. Fiona's now going to demonstrate the correct way to get up from a lying position without using her abdominal muscles and to avoid putting a strain on her abdominal muscles and her back. She's going to bend her knees up, drop her feet over the edge of the sofa and push herself up using her arms. We're also going to mention now correct lifting technique. Even when you're lifting something light off the floor, don't bend your back. Be sure to bend your knees, grasp the object, hold it close to your body and stand up.
This is a model of the pelvis and it shows you the position of the pelvic floor muscles. If you look at the pink areas, you can see that it's a supportive sling of muscle supporting all the pelvic organs up in place within the pelvis and the abdomen and giving integrity to the three openings in the pelvic floor. So if you look closely at this model, you can see that there's three openings there. You have the opening for the urethra at the front, the vagina in the middle, and the bowels at the back. Keeping the muscle nice and strong gives strength and integrity to those three openings, so it is important to maintain continence. Now, the most common type of urinary incontinence is what we call stress incontinence, and that is experienced by a lot of women after they've had a baby. This is the kind of leakage that occurs when you cough, jump, run, sneeze, laugh. In other words, when there's an increase in pressure going down through your body, and this presses all the structures within your pelvis, and if your pelvic floor muscles aren't strong, it allows a little bit of urine to leak out. Now, the other form of pelvic floor dysfunction is what we call prolapse. Now, prolapse is where the supporting fibromuscular structures between your pelvic organs weaken. And this can cause a bulge, and that bulge tends to bulge into the vagina. And then because we're upright, then that bulge comes down, and women can experience the feeling of that bulge coming down and out, which can be very uncomfortable. So what I'm going to do now is teach you how to do a correct pelvic floor contraction. Now, you can do pelvic floor exercises sitting, standing or lying. So maybe get yourself in a comfortable sitting position. Sit nice and upright in a chair with your spine in a neutral supported position. So maybe put that pillow behind your back. Okay? So you're imagining you're trying to stop the flow of urine at the front and at the same time as if you're trying to stop wind at the back. And it should feel like a lift and squeeze up inside your body. So let's have a little go doing that. So imagine that you're trying to stop the flow of urine at the front. Imagine you're trying to stop wind at the back, and lift and squeeze, hold it for a few seconds and let it go. It's very important that you can feel that let go, because that's the only way that you can monitor yourself when you're doing the exercises at home. So let's have a go doing that now. So I'll count to 5, see if you can feel the lift, the hold and the let go after 5 seconds. Are you ready? And lift and squeeze and hold. 2, 3, 4, 5 and let it go. Now as you're doing that, it's vitally important that you keep breathing normally, so you mustn't hold your breath, and that you keep your external muscle groups nice and relaxed. So your upper abdominal muscles, your inner thighs and your bottom cheeks are those muscle groups that sometimes try to join in. However, if you're doing a strong pelvic floor contraction and you can feel any tension across your bikini line, then that's normal. So let's have a go doing another one now. And this time I'm going to count to 10 seconds. Okay? So are you ready? And lift and squeeze and hold. 2, 3, 4, 5, 6, 7, 8, 9, 10 and let it go. Now don't worry at this point if you can't hold for the full 10 seconds. With time and practice and repetition, that should improve. If you can't feel the let go after 10, it maybe is because your muscle is releasing after 6 or 7 seconds. Okay, so just start holding for that many seconds to start with. Right, let's have another go. And lift and squeeze and hold. 2, 3, 4, 5, 6, 7, 8, 9, 10 and let it go. Now, it's very important that you don't try to do your pelvic floor exercises when you're walking, talking, driving, at the computer, any of those activities. In order to do a strong, good quality contraction, it's important that you give it 100% concentration. So you need to be still and you need to be really concentrating on it. Now, the exercises that we've just done are what we call slow, sustained contractions, and they help to increase the strength and the endurance of the muscle. What we're going to have a go doing now are some fast contractions, and what these contractions do is train the muscle to respond very quickly for when you cough and sneeze. So let's have a go doing those now. Up to 10 contractions. So are you ready? And lift up, let go. 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 Again, practice will help these to improve if you find them a little difficult or find it quite tricky to coordinate. Now, the fast contractions help the muscle to respond, as I say, when you cough and sneeze. I want you to try a little exercise now so that you can understand how well that mechanism works. What I want you to do is do nothing with your pelvic floor for a moment and just have a hearty cough as you're sitting in the chair. A bit like this. Now, can you feel everything pressing down into the chair underneath you? What I want you to do now is lift and squeeze your pelvic floor muscles as strongly and as quickly as you can, and then do that same cough again. Now, hopefully this time you'll feel that you don't get that downward pressure in the same way. And that shows how effectively the muscles can work to help you. And that can help to protect against a prolapse and protect against any leakage when you cough and sneeze. So it is good to get into a regular conscious habit of always pulling up your pelvic floor muscles before you cough and sneeze. Now, ideally, you want to be holding your pelvic floor contraction for 10 seconds. Ideally, you want to try and do 10 repetitions, followed by 10 fast ones. So that's what you're aiming for in a set of exercise. And we do advise that you try to do 4 sets of exercise each day. As I say, you can do them sitting, lying or standing. So lying is the easiest because you're not pulling the muscles against gravity. So that really comes into its own straight after you've had your baby, when things might be a little bit tender and a little bit weaker down there. Start trying to do your exercises very, very gently, maybe not pulling up quite as strongly, maybe not holding for as long, and then with time and practice, that should improve. doing the exercises when you're sitting feeding your baby is also an ideal opportunity. And in the fullness of time, you could progress to doing the exercises when you're standing, which is the hardest position purely because of the way that gravity acts on your body. Straight after you've had your baby, don't worry so much about the fast ones. Just have a go doing the stronger ones where you're lifting and you're holding. And doing those quite soon after you've had your baby gets the muscles contracting a bit like a muscle pump. And so if you've got any swelling down there, it helps to pump the swelling away and brings healing cells into the area. Keep trying to do these exercises from now on until about 6 months after you've had your baby. If at that 6-month mark you've got no problems at all, we would advise that you could then drop the regularity of your exercises down to doing 2 sets a day. And we do recommend that you try to do 2 sets a day for the rest of your life to keep your pelvic floor strong and so that you don't run into problems later in life. There are typical muscle groups within the body that tend to carry our tension. And what we're going to show you now is a relaxation technique that can be a lifelong strategy that you can use whenever you're aware that you're carrying tension during your pregnancy or afterwards. And it's based on the idea that certain muscle groups get tense. So what we're going to do is work the opposing muscle groups and get you contracting those and give the tense muscles just a chance to lengthen and relax. So get yourself sitting comfortably in a chair. Get your back nice and well supported and put your hands on your thighs. Now you can close your eyes during this technique and it's completely up to you. So you might want to keep them open just so you can keep watching us for now. And once you've practiced it a few times, then you can close your eyes. First thing that I want you to do is have a nice big breath in and just blow that breath away out of your mouth. Okay, now before I start, I want you to just put one hand on top of your bump and I want you to just start breathing in a nice gentle and relaxed way. And as you breathe in and out, I just want you to be aware that as you breathe in, your hand rises gently. As you breathe out, your hand falls. This is because you're breathing nice and deep into the basis of your lungs, and as you do that, your diaphragm descends. As your diaphragm descends, it's pushing your tummy out. So you're breathing nice and low into your chest. So put your hands back on your thighs. Now, we're going to do the technique by me giving you an instruction to contract a certain muscle group. Then I will say stop. And then I might say something to get you to feel and appreciate how that part of your body feels differently. So we're going to start off with an instruction for the shoulders, which is a very typical area of the body where you can carry tension. Okay, so the first instruction is to push the shoulders down towards the waist. So you're pushing them down as strongly as possible. And then stop. Now, as I say stop, you'll have felt that the shoulders come up again, but hopefully they're a little further down than they were before, and your neck should feel longer. Now we're going to think about the posture of your arms, and I want you to slide your hands forward towards your knees, so you're straightening out and opening at the elbows. Hold that position, and then stop. Just let the arms flop back into a natural position, and the elbows should be softer and more open than they were before. Now, keeping the front of your wrists in contact with your legs, I want you to lift your hands up. Keeping your wrists in contact with your legs and widening your fingers and thumbs out as wide as they will go, and hold that position. And stop. Your fingers should feel longer than they were before, and your thumbs should feel nice and heavy. And it is at this point that you should be feeling a nice heavy feeling coming down through your shoulders, through your elbows and into your hands. Now we're going to think about the posture of your hips. And a very tense posture of the hips is with the hips rotated towards each other in this kind of position. So to help them to relax, you just make more of a gap between your knees. Hold that position for a moment or two. And then stop. And try not to actively bring the knees back together. Now, to work the posture around your knees, I just want you to work your feet forward and then lift your legs up so that they're fairly straight. And then stop, just gradually lowering them to the floor. Try not to pull your feet back towards you, and that this just keeps the knees in a softer, more open position. Now, go a bit easy on the next instruction, particularly if you get any cramp in your calves at night. We're going to point the feet away from the body. So pointing your feet and stop. And that lovely sense of heaviness and relaxation should be coming now down through your shoulders, through your arms, through your thighs and your knees, right down to your feet. Now just working our way back up the body, I want you to very gently push the back of your waist into the chair behind you. Just be very careful not to push any weight through your feet. And stop. Now I want you to imagine that you've got a pillow behind your head as if you're lying down, and you're going to push the back of your head into the pillow. So push back, but try to do that without tilting your head up or down. So keep your face completely level, and you're pushing your head back as if you're trying to give yourself double chins, like this. And stop. Now, with your eyes closed, I want you to press your eyelids together a little more firmly than they were before, but try to do that without scowling or frowning. And stop. And now, keeping your lips together, I want you to drag your lower jaw down away from your top jaw so you're making a gap between your teeth, but remember to keep your lips together. And this gives a very, very nice stretch for those muscles that tend to get tense if you find that you're holding your jaw very tense or you're grinding your teeth. And stop. And just stay in that position for a moment or two. All that you should be aware of now is the gentle rise and fall of your tummy as you breathe in that nice, gentle, relaxed fashion. And the rest of your body should just feel heavy and relaxed. So that's a quick demonstration of this particular form of relaxation. And this is something that can be used during your pregnancy, if you're having a rest in the afternoon, if you're feeling particularly tense. You can try this just to give yourself more of a sense of relaxation and rest. The method isn't particularly designed to induce sleep, but if you're struggling to sleep at night because you're up and down to the toilet or you're struggling to get comfortable, this might help to induce more relaxation and help you get to sleep. Once your baby has arrived, if baby is having a sleep during the day, then this can be an opportunity for you as well to either lie down and just have a relax even if you don't get to sleep. This is something that you can use for the rest of your life. Now, what we've shown is using the whole relaxation technique in its entirety. What we're going to go on and talk about very shortly is extracting some of these individual techniques and showing how you can incorporate those into the coping strategies for the first stage of your labour.
Okay, so as an introduction to this section, I'm just going to give you a little bit of an idea about the signs that you might expect that may tell you that you're going to go into labour. Many women are very worried about whether they will know whether they've gone into labour or not, but don't worry about it. You will know, you will have an idea, and we're always there at the end of a phone for advice and support. There are 3 main signs that may tell you that you're going into labour. The first one is you may experience what we call a show. And what that is, it's a plug of mucus that comes from the cervix. And I'm just going to display a picture that will just show you where that plug of mucus sits. So this is your cervix here. This is the bladder, this is the pubic bone, and this is the rectum. This is your vagina here. So you can see in this picture that the cervix is really long and thick. And that's how your cervix looks ordinarily when you're not in labour. And the process of labour is to get that cervix to thin, so it shortens and it starts to open, so it starts to dilate, and that's the term that we use. So this cervix here is in a woman who's not in labour, and that's how your cervix would look at the present time. And in the middle of the cervix here is a plug of mucus, and that mucus is there to stop infection from getting through to where the baby is. And when your body starts to change, so that you start to go into labour or prepare yourself for labour, that plug of mucus can come away. And it can come away as a big plug, or it can come away a little bit at a time, or you may not ever have a show. So you mustn't be concerned if any of those things happen to you. The plug of mucus is sort of jelly-like. It's quite mucousy, and it can come out as a clear jelly in a big lump. It can come out a little bit of a time, and it might be stained, it might be brown stained, and that's absolutely fine because the cervix is very vascular, which means it has a really good blood supply to it. So there can be old blood mixed with the jelly, and that's absolutely fine. Or as I said before, you might have none at all. Any of those, absolutely fine, all normal. I have to say at this point, if you ever have a bright red vaginal loss, at that point you have to ring the hospital just for advice. It might be absolutely fine, but you must ring for advice. So the second thing that can happen is your waters can break. And I have a picture here. It's a fairly obvious thing to happen. The baby is in a membrane which is full of fluid. And at some point that membrane will get a tear in it, a slight tear, and you can lose the fluid through the tear. And it can come out, as in this picture, as a big gush, or it might just trickle and you might just notice that you're very damp from time to time. If your waters go, you need to ring the hospital for advice. It may be that you go into labour straight away, in which case they'd say to you, stay at home, see what happens, just await events. But you might not actually go into labour. You don't always go into labour when your waters have gone. So you ring the hospital for advice and they'll tell you what to do. The final thing, and the most diagnostic thing that can happen that can tell us that you're in labour, is that you'll start off having some contractions. And contractions are where the uterus tightens and becomes smaller, and that feels like a very strong period pain. And it starts off just above your pubic bone, and it builds up, and it waves up to the top of your bump, and then it waves down again and goes away. And that's what we call a contraction pain. If your contractions are strong, regular, and an equal distance apart, then you're probably a good chance there that you're going into established labour. Contractions normally last up to a minute when you're in established labour, and they're normally the same distance apart from the start of one contraction to the start of the next. They're also all of equal strength when you're in established labour, so you don't have some strong ones and some minor ones. They're all the same strength. And what's happening with those contractions is it's pulling up the cervix to make the cervix open. And you can see in this picture, this is a woman who is probably just heading towards established labour. And you can see that the cervix, which was previously really thick and long, has become really thin and has started to open, so that you could actually see, if you could see that, properly, you'd be able to see the membrane through the gap in the cervix. So this lady is about 1 centimetre dilated, so she's probably having some contractions and she's in early labour. Once the cervix is about 4 centimetres dilated, we say you are in established labour. The thing to remember is no matter what happens, if you're not sure, just ring for advice. We're there at the end of the phone. There are 3 distinct stages of labour. The first stage of labour is from when you start off in labour up until you become fully dilated, which is 10 centimetres dilated. At that point, you start pushing, and that's the second stage of labour, where you push your baby out. So it lasts from being fully dilated until the birth of the baby. The final stage of labour, the third stage, is from the birth of the baby until you deliver your placenta. So now I'm going to hand over to Fiona, who's going to talk to you about some coping strategies for labour.
So what I'd like to talk to you about now are coping strategies for the first stage of labour that Alison mentioned. And this is by far the longest stage of labour, particularly if it's your first baby. Hopefully for a lot of that stage you're going to be at home. So these are just natural techniques that you can use yourself to help you cope better with the contractions. I want to introduce 3 different strands of ideas to you. Firstly, the breathing, then the relaxation techniques that you can use, and lastly is the positions that you can be in when you're having a contraction. So firstly, let's think about the breathing during the first stage of your labour. When your labour first starts, the contractions are felt quite low down, a bit like strong period pain, as Alison mentioned earlier. When you're at that stage, you will be able to do a relaxed breathing technique very much like you were doing during the relaxation session that we did earlier. So I just want to highlight what's special about that style of breathing to help you. It's very easy, as we're all sitting here in nice comfort, nobody's having a contraction, to just breathe in quite a mindless way. When it comes to actually having a contraction, you need to be able to think of specific things. Those things might be that you're breathing nice and low into your chest. There's best exchange of oxygen and carbon dioxide in the bases of your lungs, so that's why it's better to breathe quite low down. The second idea is that you want your breath out to be about twice as long as your breath in, and that is the normal ratio of breath in to breath out when you're doing just relaxed breathing. Now this is in stark contrast to the style of breathing that you would do if you were out running. If you're out running, you're breathing quite hard, okay, and your breath out and your breath in are about the same length. Now, if you breathe like that and you were sitting in a chair, that would be over-breathing or hyperventilating, and that really isn't good for maintaining correct levels of oxygen and carbon dioxide in your bloodstream. So remember, a nice long breath out, and that's a rather good thing to be able to concentrate on when you're having a contraction, because it's a form of distraction and it can distract your mind away from the contraction. Last but not least, you want to have a pause between breaths. We don't tend to rush headlong from one breath to the next. So you're breathing nice and low into your chest, you're having a nice long breath out, a bit like this, and a pause before you take the next breath. That's what we call the basic breathing technique, and you should be able to do that for the majority of the first stage of the labour. But once the contractions become much stronger, and rather than just feeling quite low down, they're coming quite high up your abdomen and quite near to your diaphragm, it's at this point that you might want to modify that breathing technique, and so you're just lightening it a little. Okay, so put one hand on the top of your bump, put the other hand here, and this modified breathing technique is literally just a lighter breath in, so you're not taking in as much air, and you will feel that the diaphragm isn't descending to the same degree, so your hand shouldn't move, okay, and you just, so just try and have a join in now, and just take that lighter breath in, and still blow it out. So your modified breathing, you've still got a nice long breath out, you've still got a pause between breaths, it's just a lighter breath. So you've got your basic breathing and your modified breathing. And that should take you until you're 10 centimetres dilated. Now I want to talk to you about the relaxation techniques that you can employ as you feel a contraction starting. So if you're doing all this lovely breathing, but each time you feel a contraction starting, you're getting really tense, so you're grabbing onto your partner's hand like this, or hanging onto the bed, or getting really tense around your shoulders and your jaw, this isn't helping your cervix dilate any more quickly, and can be very exhausting if you get tense with each contraction. So what we suggest you do is think about where you hold the tension in your body. Do you get very tense in your jaw, for instance, or do you clench your hands or your shoulders? Think about 2 or 3 areas where you tend to hold your tension, and as you feel the contraction starting, do those relaxation techniques. So do your jaw technique, lower your shoulders, stretch out your hands. Do that as you feel the contraction starting, and then you're using that as a springboard to remain relaxed for the remainder of the contraction. And if you need to repeat them through the contraction, you can do that as well. Last but not least is positions. Now, one of the things that prompts us to go into labour in the first place is the pressure of the baby's head bearing down on the cervix. So you do want to think quite carefully about what positions that you adopt, particularly when you're in the early stages of labour. The last thing that you want to do really is lie down flat. You want to try and maintain some kind of pressure of the baby's head bearing down on the cervix. So you want fairly upright positions. So what we're going to demonstrate now are a few positions that you could adopt. And what we're going to round off this whole film doing is a couple of practice contractions so that you can put all those elements together. So you can put the breathing together, you can put practicing the relaxation techniques together, and just try out one of these positions. So Ros is now going to show us a few positions that you could use during your first stage contractions, which ensure that your shoulders are higher than your hips. Okay, so first of all, you don't have to be sitting. You could be standing, using the kitchen counter, just leaning onto the kitchen counter and just swaying your hips, and that can feel quite therapeutic. You could get down on the floor, on your hands and knees, but just ensure you keep your shoulders higher than your hips. Or you could use a birthing ball, leaning forward on one of those. So now we're going to put all those elements together. So I've talked about breathing, I've talked about the relaxation techniques, and now I've talked about positions. And I'm going to talk you through a couple of pretend contractions, and we're just going to put all those elements together so you can get an idea of how they all slot together. So get yourself into a nice comfy position, maybe one of the positions that Ros has shown you. And we're going to start with you having a contraction and you're about 3 or 4 centimetres dilated already. Okay, so choose your relaxation techniques. Maybe you're going to use your hands, your jaw, your shoulders, wherever you know that you carry your tension. So are you ready? So your contraction is starting now. So do your relaxation techniques and hold them for about 5 or 6 seconds and then just let them go. And this contraction is starting quite moderately. It's all fairly low down. So start to think about your relaxed breathing. So you're breathing nice and low into your chest. You've got that nice long breath out and you've got a pause between breaths. The contraction is building to about its peak now, so repeat your relaxation techniques again if you need to, and just carry on with that nice relaxed basic breathing technique. Now you're over the worst. The contraction is starting to subside. Repeat your relaxation techniques if you need to at any point, and just carry on with that basic breathing. The nice long breath out, the pause between breaths. The contraction is now fading away, and it's gone. So that is an early first stage contraction. Now we're going to talk through a later first stage contraction, maybe when you're about 7 or 8 centimetres. So I'm going to keep Ros in the same position for this, and we're going to employ the basic breathing technique and the modified breathing as well as you go over the peak of the contraction when it's its most intense. Okay, so maybe stay in the same position that you're in, and the contraction is starting now. So do your relaxation techniques. Again, holding them for about 5 or 6 seconds. You're just doing the basic breathing at the moment. Now let them go. This contraction is gathering pace much more quickly, and so it is at this point that you do the modified breathing. So bring the breathing higher up into your chest, but still think about a nice long breath out and a pause between breaths. You're about at the peak of this contraction now, so it's at its toughest point. Repeat your relaxation techniques again if you need to. As the contraction starts to subside, as it's now doing, you can bring the breathing lower into your chest and go back to your basic breathing. So you're over the worst and the contraction is starting to subside and it's fading away and it's gone. So well done. What I would advise that you do from now until the day that you go into labour to have your baby is that you try to do one of these pretend contractions each day. And what that does is it lodges the memory of what you're supposed to be doing and everything that you're putting together into your long-term memory. That will give you a head start when you go into labour because you're not trying to rack your brains to remember what I've said on this film. And you'll have a confidence in what you're doing. So you can just go into more of an automatic mode and start to employ all those techniques that you've been practicing. And having that confidence in what you're doing is very much associated with better outcomes for you and for your baby.
Okay, so finally, this is a section on massage, which you can use together with all your relaxation techniques that you've learnt, but this might be especially relevant for your birth partners to have a look at, and I'll reinforce this in the antenatal classes that you'll attend later on in your pregnancy. It's a case of going from head to toe and thinking what might help to relax your partner. So start off at the top, hands on the head. This can help to relax the jaw. Just run your hands down and out over the shoulders. Start on the head, take it down and push the stress away. Then you can work on the shoulders. Shoulders tend to raise quite significantly when you're in labour. When you're in it, they really tense up. So you want to put some weight on those shoulders and run down and off. Run down and off. So in each case, you're not just using light hands like this. You want to really put the pressure on and push that tenseness away. If we think about the back, you can either run straight down the back and off through the hip, straight down and off through the hip, or you can go in a diagonal way. So from one shoulder, across the back, out through the hip. The other shoulder, across the back, out through the hip. And all the time you're saying, Ros, how's that? Does that help?
That's great.
Any stronger, any weaker?
Yeah, I can cope with a bit more pressure.
Okay, so again, go by what your partner tells you. Put the strength on. It's normally good to put more pressure on than not. The other thing is when you're in labour, is it tends to be right at the base of your back, right down here in your pelvis. This is the real tense place. So you can either use the ball of your hand and just use circular movements like that, or you can use a massage tool, which you can pick up in any supermarket and they're really easy to get hold of, and run them round. Or you could even use a tennis ball. It's just as easy. But I wouldn't use a tennis ball against the bare skin. Make sure there's some padding there underneath. Okay, so finally, when we think about those tense hands, if the hands are tense, which they tend to do during a contraction, we want to try and encourage them to release. So down the arm and out through the hand, right to the fingertips. Take it from the shoulder if you're in a position to do that, right out through the fingertips. Just make those hands relax. And then finally, the feet as well. The feet can actually tense up too, and you can actually see toes curling when they're having contractions. So down the legs and out through the toe. Remember to always throw that tenseness away. So brush it off the end of the limb, so the end of the toes or the end of the fingers. And that should really help to relax them. So it will really complement those relaxation techniques, and it's a way of distracting them as well to get them through those contractions. So enjoy it. Good luck.
Thank you for watching the film. We hope we've given you some useful information.
And don't forget that you can dip in and out of the different sections of the film throughout your pregnancy.
And please don't forget to book on for your antenatal classes. I look forward to seeing you later on in your pregnancy. Good luck. Enjoy it.